I think that patients now connect to the clinics, to the doctors, and to their possibilities more than choosing the country like a country.
I've spoken to dozens of IVF experts. Now I'm traveling around Europe to interview the best IVF specialists in person. I'll be asking them difficult questions. Some questions come directly from you, patients. Be sure to follow fertility clinics abroad and drop me your question in the comments. Your question could be featured in the next video. Today I'm in beautiful but cloudy London, and I'll be interviewing Dr. Robert Najdecki from Assisting Nature in Greece. Welcome to IVF Off the Clock. I'm Dorothy, and today I'm in beautiful London in South Kensington, and I have the pleasure to interview Dr. Robert Najdecki from Assisting Nature Greece. Robert, how are you today?
Thank you, Dorothy. Very well. This is a great pleasure, and thank you for this kind invitation.
Thank you that you are here with me. So please, can you introduce yourself to the UK patients?
My name is Robert Najdecki. I am a reproductive medicine specialist. I have been working in this field for more than 30 years, starting from the beginning, from the first child from IVF until now, until nowadays, when we use very sophisticated and very different procedures in our practice, in lab, in genetics, and in all this field of IVF.
Is there one thing that you specialize in?
Of course, in my road from the beginning to nowadays, I passed from many stages. From the beginning, it was research in stimulation protocols, after in laboratory details, now in hysteroscopic endometrial incision and enhancement of implantation possibility. I can say that it was all these issues in my career.
Okay, so you mentioned that you've been working in the IVF sector for over 30 years. So I'm wondering what still inspires you in IVF, in fertility?
Of course, for me, it was not only academic and professional career, it was also this relationship with the patients and this personalized contact with patients all these years. I think this is the most important thing, keeping us and giving us a motivation to go ahead.
So today we are in London. So I'm wondering, what are the things that UK patients most often ask you?
Firstly, London, it's my beautiful and very specific town. I have a specific relationship because here my first tube baby, IVF baby, lives. And he is now a very successful professional. And this is connecting me with London anytime that I'm here. And I feel very, very comfortable in this town. The English patients, British patients, of course, are interested in all procedures, but mostly in the egg donation, embryo donation, PGDA treatment, and of course we are asking about all these issues and how to prepare to the treatment, how to organize this trip to Greece, and of course about our possibilities to keep the best level of our facilities.
So actually, why do UK patients choose Greece as a destination for the IVF treatment?
It's a very good question, and I think that most of the patients feel friendly and have a very good opinion about the level of Greek IVF centers. Of course, we have most of our doctors are taught in US or in United Kingdom, in Brussels also, that we keep the high level, and we are a great hub of IVF treatment generally in Europe. Another way, I think that patients now connect to the clinics, to the doctors, and to their possibilities more than choosing the country like a country. Of course, Greece is able to add to the treatment their very, very good facilities in vacations compartment. That adding this to the medical services, of course, it's established very, very good level of services, which are, I think, most commonly chosen by British.
Once the patients decide to travel from the UK to Greece for treatment, so what treatment do they most often choose? Egg donation, PGDA, embryo donation, or perhaps IVF with own eggs? Can you tell us?
Yes, I think that our British patients are patients with IVF history in most of cases, and then they are choosing most of egg donation, embryo donation, PGDA treatments. Actually, of course, our strength is that Greece is working mostly in fresh donors, that it's able to provide and to offer to the couples very, very, very perfectly chosen and matching donors. This is very important, of course, for it. Also, PGDA programs are available and very well established in Greece, providing a very high level of medical services. For example, in our clinic in Thessaloniki, we have the PGDA lab in-house inside the clinic, and this is allowing us to control everything and to have and to work with quality management in very, very high standards, and translating it to the simple words, our geneticist is present during the blastocyst transfer and can provide their conclusions, add some procedures to it, control embryologists. From the other side, doctors may control all the system, and then I think that it's working more properly and more successfully. And then the normal invasive PGDA, which is called invasive, it's not really invasive. It's something in the middle, going to the non-invasive. And of course, patients are looking for this information. They are able to realize all the differences. And this is one of the reasons that they are choosing Greece and our clinic also.
Let's now talk about IVF with donor eggs, the process in Greece. So how exactly is the process organized at your clinic?
Of course. The process is starting from the point that we are trying to choose and to match the donor patient for our British patient here. Then we collect some phenotypic data, photos from 20s of girls, also the blood groups, and all this necessary things that we must know. And then we are starting the matching process, which is, of course, supported by AI now procedures. And in the end, we are able to offer to the couple at least 2 donor profiles to choose and to think about what is more convenient to him. And from this point, we wait for one short visit in Greece to collect the sperm sample. In case, of course, then we are working only with egg donation. If we work with embryo donation, that it's another issue. We are doing the same process with matching the sperm donor for this patient. And then we collect, after collecting the sperm, we are able to start all the process. That when our donor patients starting the procedures, starting the stimulation process, of course we try to inform all parties that we are starting the program. We are going until the blastocyst stage, vitrified blastocysts. At least 2 blastocysts in normal program are confirmed. And of course, it's for at least 2 transfers for the couple.
Okay, so do you offer fresh or frozen cycles?
We are working only with fresh eggs and fresh donors, going to the stage that we frozen the blastocysts. This is the best way now, and really with the same, absolutely the same results. Why? This model giving us the opportunity to control better the process of preparing the endometrium in the acceptor patient. And then we are able to not to transfer very quickly and pressing all the systems with days, with progesterone levels, etc., because we are working until the day of the transfer, and then the thawing of the embryo is doing in the same day. That even something go wrong with travel, with preparing, with progesterone levels, in the last moment, we are able to stop and not to lost the embryos for bad transfer, let me say.
Okay, and what is the availability of egg donors that you offer?
Age?
The time of the donor eggs being available, and perhaps age and phenotypes.
Yes, of course. Generally in Greece, we have now the new rules about the donor treatments. This is very important also for the patients, because this is controlled by our authorities, that every donor patient are able, firstly, she's in the general country registry. That's it's not able to go into another clinics, yes, to pick up the eggs. She's controlled by the authorities. That these girls are able to have until 10 child in all her life, including her own child. That the best donor patient is donor with confirmed fertility, with 1 or 2 child, and somewhere in the middle of the line, let me say, giving you the possibility to perform and to finish all your programs. In other way, if you will have the child, first child with this donor, then authority is allowed you to proceed into another transfer with blastocysts, which are frozen in our banks. that I think that this is also very, very important for the patient because it's controlled all the system. And of course, this is keeping the patient in a really safety level.
That's it for part 1 of the interview with Dr. Robert Najdecki. Stay tuned for part 2.